66-year-old gentleman came to me very frustrated and unhappy. He used to enjoy long walks and trekking. In the last few years, he started struggling to stand and walk. Initially, he could walk long distances, and though he experienced some pain with tingling and numbness in legs, that did not stop him from his passion of walking. However, over time, the intensity of this discomfort would worsen if he persisted to walk or stand. It would become unbearable and he had to sit. Sitting would relieve the pain and numbness and he could walk again. These symptoms worsened with time and now he was struggling to walk even 100 yards or stand for 4 to 5 minutes. Going out of the house became a frightening experience. He would always be on the lookout for a place to sit. He had a condition called Lumbar Canal Stenosis. Hi, I'm Anant Kamat, consultant neurosurgeon. I specialize in spine surgery. This video is one of the series of videos I'm producing to give information about spine conditions so those affected can understand why they are getting their symptoms, how to manage them, when to seek medical help, and what symptom one should watch for which needs urgent medical attention. We'll talk about lumbar canal stenosis in this video, its symptoms, investigations, and management both non-operative and operative. Lumbar canal stenosis is a condition where the canal through which the nerves pass in the lumbar or lower back region of the spine is narrow. This can lead to disabling symptoms in the legs. This is an illustration of the lumbosacral spine. This is in front, this is behind, this is the top of the spine, and this is the bottom of the spine. These three bones represent the lumbar bones, while this represents the sacrum. These bones are behind the spinal canal, while these bones are in front of the spinal canal, and this part is the spinal canal. The spinal canal contains a sac, and that sac contains the nerves. This is an illustration of lumbar canal stenosis. Here you can see that there is disc bulges in front and ligamental bulging posteriorly, making the canal through which the nerves pass narrow. This is aggravated or made worse in standing and walking position, while in sitting position, because the person bends forward, the canal opens up. The facet joints can sometimes give rise to cysts called facet joint cysts, which can further narrow the canal. Sometimes normally present fat in the canal can increase in size due to increase in body fat. This can contribute to the narrowing of the canal. Spinal canal dimensions are affected by our movements. When one bends forward and backwards, there is an effect on the ligaments, the disc, the spinal sac covering the nerves. This is the spine model, this is the sacrum, these are the lumbar bones, these are the discs, these are the bones behind, these are the spinous processes, and the facet joints, which becomes hypertrophied, causing narrowing of the canal. Now when we stand, we usually have a tendency to bend backwards, and you can see immediately how the canal becomes narrow and can cause the symptoms in the legs. While when we sit, we have a tendency to bend forward and it opens up the canal, and hence it relieves the symptoms. When there is narrowing of the spinal canal around the nerves, it is made worse on standing and walking. This leads to symptoms in legs on standing for some time or walking a particular distance. This is called Neurogenic Claudication. There can be pain, numbness or weakness in legs. Usual scenario is worsening pain and or numbness on standing or walking. The foot can become floppy as one keeps on walking. These symptoms improve on sitting. As the canal dimension improves with bending forward, as seen in this illustration. When we bend forward or when we sit, the ligaments both in front as well as behind, they get stretched, and hence the lumbar canal stenosis improves to some extent, and the leg symptoms may improve when a person sits down. It is not unusual that bending forward makes walking easier. One may prefer to lean on a trolley, which will allow them to walk longer with less discomfort in legs. Rarely, there can be progressive weakness, numbness in legs, or bladder or bowel dysfunction. This is a neurosurgical emergency, and I would recommend seeking urgent medical advice. Vascular claudication is a condition where the blood supply to the legs is poor. It can have very similar symptoms as neurogenic claudication due to lumbar canal stenosis. There are some ways of differentiating between the two. Usually, in neurogenic claudication, the pain is in the distribution of the nerves. There can be associated numbness or weakness in legs. Walking down a slope is more difficult in neurogenic than in vascular claudication, as one has to bend backwards, which makes the lumbar canal narrower. In vascular claudication, there may be obvious vascular deficiency changes in the feet. For example, pale feet, difficulty in feeling pulse. Feet may feel cold than the rest of the body. MRI is the investigational choice for this condition. It is an investigation which uses a strong magnet, and it delineates the soft tissue of the lumbar spine very well. It shows the levels involved and the extent of narrowing, and also rule out other causes, including rare sinister causes of neurogenic claudication. It will be difficult to prevent wear and tear changes in the spine completely. However, maintaining good spine health may reduce chance of symptomatic lumbar canal stenosis. Good spine health is to maintain good posture at work and at home. Keep the group of muscles which support the spine in good shape. At the same time, maintaining flexibility of spine. Having one's weight within normal range is very important to reduce the stresses on the spine. It may also reduce the fat in the spinal canal and help prevent symptoms. Many a times, this condition can be managed without surgery. The symptoms may not progress in many. There's a good chance they may remain static or even improve. If there is a disc component contributing to the canal stenosis, there's a very good chance it will improve. Sometimes epidural fat contributes towards canal narrowing, and losing weight can help the symptoms. Weight reduction will also make it more easy to walk longer distances as the legs are carrying less weight. Gradual incremental exercise, including gradually increasing walking distance, will help improve and even resolve symptoms in many. Surgery is an option available to relieve leg symptoms caused by lumbar canal stenosis. The symptoms of lumbar canal stenosis can be significantly disabling to some. One may struggle to walk. One is always on the lookout for a seat. This can be very stressful and can make one very anxious if they have to go out. It can be a struggle even at home. It can be a struggle even to stand for any length of time, and this can greatly affect day-to-day activity. If the symptoms are affecting the quality of life and conservative treatment has failed, surgery is an option. Surgery can decompress the nerves, and hence there is a very good chance of improvement of symptoms. Of course, there are limitations and risk of any intervention. One has to weigh the beneficial effects against the potential risk and limitations before opting for surgery. Surgery can be either direct decompression of the spinal canal or indirect decompression using an interspinal spacer. Lumbar decompression is a surgical procedure where we make a small incision in the lower back, remove the bony and soft tissue encroachment in the canal, and make space for the spinal sac and the nerves within. It is a very straightforward operation with uniformly good results for leg symptoms. Interspinal spacer is a device that is inserted between the spinous processes or the bones at the back of the spine to create more space indirectly in the spinal canal without actually removing the bone and encroaching soft tissue on the spinal sac. This mimics the position that spine takes when we are sitting or bending at the level where the spacer is inserted. So the take-home message for lumbar canal stenosis is lumbar canal stenosis is due to normal wear and tear changes of spine. It is mostly self-limiting and there is a good chance that symptoms may improve. It can be managed without surgery by maintaining good spine health. However, surgery is a very good option when non-operative management fails. I would like to state here that if you do develop any progressive weakness or progressive numbness in legs, numbness in back passage area, or any bowel bladder dysfunction, you have to seek medical attention immediately. I hope you enjoyed the video as much as we enjoyed bringing it to you. If you feel that it will be useful for someone else, please feel free to forward it. If you want to see more of my videos about other aspects of spine, you may wish to subscribe and press the bell icon. Wish you all a very healthy spine and see you all soon.